بسم الله الرحمن الرحيم. Aortic surgery. As we see, anatomy of the aorta, aortic roots, sinotubular junction, ascending thoracic aorta, aortic arch, descending aorta, and abdominal aorta. Two distinct pathologies, dissection and aneurysm. Predisposing factors, Marfan syndrome, hypertension, atherosclerosis, and infection. Aortic dissection. Tear in the intima of the aortic wall allows blood to enter and flow in a false channel. The two aortic lumen and false plane of dissection channels are separated by dissecting membrane or flap that contains aortic media and intima. Classification: DBK1, here dissection involving starting from aortic valve to the whole aorta. DBK2, just ascending. DBK3, just descending and abdominal aorta. And Stanford A and B. Stanford A, as we see in picture, the whole aorta or the ascending aorta. Stanford B, just descending aorta. Patent type and complete thrombosis type. Staging: acute, first 2 weeks, subacute, first 2 months, chronic after the second month. Presentation: pain is severe in the chest, front, back, or both. Its location indicates the portion of the aorta involved in dissection. Dissection can weaken the outer wall of the aorta, resulting in rupture or formation of an aneurysm, progress and include aortic branch vessels causing myocardial infarction, stroke, kidney failure, bowel ischemia, paraplegia, limb ischemia. Disrupt the aortic valve annulus and resulting in valvular insufficiency and cardiac failure. Presentations: chest pain, back pain, migrating pain, aortic regurg, cardiac tamponade, whatever. Investigations: transthoracic echo. The aortic root is visualized in the parasternal long axis and modified apical 5 chambers view. The suprasternal view, the aortic arch, and the 3 major supra-aortic vessels. Transesophageal echo. The most important transesophageal view are the high transesophageal long axis. The sensitivity of transesophageal echo in aortic dissection reaches 99%. The distal ascending aorta just before the innominate artery remains invisible, a blind spot. CT chest. View the upper thoracic branches and femoral arteries for the detection of aortic dissection. Triple rule out to evaluate the patient with acute chest pain in the emergency department for the 3 potential causes: aortic dissection, pulmonary embolism, and the coronary artery disease. Drawbacks of CT: Viable CT administration of contrast agent, allergic reaction or renal failure. Use of ionizing radiation may limit its use in young. Picture of CT chest showing the flap. CT scan demonstrating a dissecting ascending aorta within 64 slice scanner. And here we see the flap which separates between false and true lumens of the aorta. MRA. Treatment: mortality in acute dissection is 50% during the first 48 hours without treatment. Type A, immediate surgery, tube graft replacement of the ascending aorta through sternotomy, involving of the aortic valve, requires resuspension of the aortic cusps or aortic valve replacement. The coronary ostia may need to be implanted into the tube graft. Pental's procedure. Aortic root replacement, Pental procedure. Original operation, Pental and De Bono in 1964. composite valve graft with coronaries left intact in the aortic wall. Modified Bontal procedure involved mobilization of the coronary ostia and reimplantation graft. In 1981, Cabral and colleagues used 8 to 10 mm Dacro graft to facilitate restoration of coronary flow following aortic root replacement. Such simplified picture to show Bontal procedure. Cannulation in such cases of aortic dissection may be axillary or femoral cannulation, as we see in picture. Here a picture of commercially available composite valve graft with mechanical valve prosthesis. Picture of operation after removal of the valve and ascending aorta. Type B aortic dissection is stabilized medically and may not require immediate surgery, sedation, analgesia. Lower the blood pressure to as low as 90 to 100 mm Hg with vasodilators as intravenous sodium nitroprusside. Slow the pulse and make the heart beat with less force with propranolol, beta blocker. If not stabilized medically, surgery with excision of the tube and tube graft replacement of the upper thoracic aorta through a left thoracotomy. TEVAR procedure. Thoracic endovascular aortic repair, as we see in picture. We do stent endovascular. Long-standing zones for TEVAR, zone 1, zone 2, zone 3, zone 0. Aortic aneurysm. Dilatation of a segment more than 55 mm. Marfan syndrome. Patients with thoracic aortic aneurysm are most often asymptomatic, and the diagnosis is made by the following imaging performed either for other investigations reasons or for screening purposes. Aortic aneurysm is less frequently relieved by clinical signs of compression, chest pain, and aortic valve murmur, or during complication like embolism, aortic dissection, or aortic rupture. Recommendations in patients with aortic aneurysm. When an aortic aneurysm is identified at any location, assessment of the entire aorta and aortic valve is recommended at a baseline and during the follow-up. يعني أنا وأنا بعمل أي investigation ولقيت فيه aortic aneurysm لازم أعمل assessment لكل الأورطة وأعمل له assessment في الfollow-up وأعمل assessment للأورtic valve. In cases of aneurysm of an abdominal aorta لازم بعمل duplex ultrasound for screening of peripheral artery disease. ممكن عيان جاي أنا اكتشفت إن عنده abdominal aortic aneurysm لازم أشوف peripheral vascular system بتاعه ممكن يكون عنده peripheral arterial disease و just to be considered ونتعامل معاه بدري. Patients with aortic aneurysm are at increased risk of cardiovascular disease. General principle of cardiovascular prevention should be considered. The surgical treatment involves replacement with Dacron tube graft when the diameter is over 5 to 6 centimeters, depending on the location and rate of recent growth and onset of chest pain. Aneurysm of the aortic arch, replacement and establishment of new connection to the arch branches. Aneurysm of the aortic root and sinuses of Valsalva with annulo-aortic ectasia producing aortic regurg, replacement with valve, tube graft, and implantation of coronary ostia into the graft زي ما اتكلمنا عليها قبل كده Bental procedure. Aneurysm of the distal aortic arch and descending aorta replaced by tube graft through left thoracotomy. Thank you.